Hello everyone. Now let's continue with what we had studied in the last class. So we were discussing the anatomy of the face. We had looked at the superficial structures which were forming the face. We talked about the superficial fascia. We talked about the muscles. These muscles were the muscles which were there to control the opening of the palpebral fissure, the nares, as well as the oral fissure. As you remember, these were either constricting them or dilating them. So either they were oriented circularly, or they were oriented longitudinally. What you see here is the orbicularis oculi part, which had three parts. We saw these were the orbital part, the palpebral part, as well as the lacrimal part. Then we saw the nasalis muscle and its compressive part, as well as the ala of the nasalis muscle, which was bringing about the dilatation of the nares. Then this is the orbicularis oris muscle, and these are the dilator muscles which were radiating out like spokes. We even talked about a deep muscle, which is the buccinator, in detail. We also discussed the motor nerve supply of these muscles. We talked about the facial nerve, how it exited through the stylomastoid foramen, entered into the substance of the parotid gland. So look at this. Here I'm just showing the exit of the facial nerve. The parotid gland has been removed. But in this particular view, you can see the parotid gland. This is the parotid gland, which is lying anterior to the auricle. Presently, we'll just keep it like that. And through its substance, through its various borders, are exiting out these branches, these whitish colored structures which you are seeing. These are the branches of the facial nerve, which are the temporal, the zygomatic, the buccal, the upper and the lower buccal, which are present above and below the parotid duct, as well as the marginal mandibular nerve. So a better view, when we look at the picture from Gray's Anatomy, you can see that this is the temporal, this here is the temporal branch which is exiting out, which is supplying the frontal belly of the occipital frontalis, as well as parts of the orbicularis oculi muscle, the zygomatic arch, the upper buccal, the lower buccal, and this here would be the marginal mandibular, and its relations with the facial artery and the facial vein can be seen. This muscle out here is the masseter. We'll be needing the masseter now. So again, this muscle out here, which is a muscle of mastication, which is going from the zygomatic arch to the angle of the mandible, is the masseter. So if you clench your teeth, you can feel this particular muscle, right? We also discussed the sensory innervation, which came in from the trigeminal nerve, various branches of the trigeminal nerve, and an important applied aspect of trigeminal neuralgia, which resulted in excruciating pain taking place in the distribution of either one of these branches, and the importance of knowing the distribution of these branches. Now let's go on to what we are going to study in this particular lecture. We will be describing and demonstrating the origin, formation, course, branches, or tributaries of the facial vessels, be it facial artery or facial vein. Describe and discuss the parts, their structure, and function of the lacrimal apparatus, and we will be discussing the path of flow of tears. So let's start with a case scenario again. An 18-year-old girl had a movie date night. She had to go out with her friends. However, she developed a pimple on the tip of her nose. Distressed, she squeezed it off. 2 days later, she came to the hospital. She got admitted with periorbital swelling around the eye. That is periorbital swelling around the eye. Throbbing headache, as well as redness around the eye, pulsations behind the eye, and fever. Now, how could a simple act of just squeezing off a pimple on the tip of the nose or on the side of the face, which we all do, result in this kind of a condition, is what we are going to explore in this particular lecture. The arterial supply of the face. Like the scalp, the face also has a rich blood supply, which is coming from, these vessels are arising from either the external carotid artery directly, or indirectly, and some of them are also branches of the internal carotid artery. They form anastomosis with each other as well as across the face. That is, from the right side, the arteries of the right side and the left side anastomose with each other. As a result, the wounds of the face also tend to bleed profusely, number one, and number two, they heal also very well. Now let's see which are these blood vessels. Now the first one is the facial artery. Look at this. This is the common carotid artery, which at the level of the upper border of the thyroid cartilage divides into an external carotid artery and an internal carotid artery. Now, from the external carotid artery, somewhere just above the tip of the greater cornu of the hyoid bone, arises the facial artery. The facial artery then has a course in the submandibular region, that is, the region which is below and behind the mandible. Thereafter, it comes on the face at the anterior-inferior angle of the mandible. This anterior-inferior angle of the masseter near the inferior border of the mandible. Now clench your teeth. Once you clench your teeth, you feel the masseter. Just anterior to the masseter. See, this masseter is a quadrilateral. At its anterior inferior angle, just anterior to it here, would be the facial artery where you can also feel its pulsations. Thereafter, it enters into the face. Now within the face, it has a tortuous course. Why does it have a tortuous course? Because it's going through a mobile structure, a structure which is always moving either for chewing or for speaking or for showing the facial expression. So we cannot have a non-tortuous vessel. It's a tortuous blood vessel. Where else in the body will you be seeing the tortuous blood vessels? That will be the lingual artery, which supplies the tongue, or the splenic artery, which supplies the spleen. Now, once from here at the anterior-inferior angle of the masseter, at the inferior border of the mandible, from there it moves about 1.5 centimeters lateral to the angle of the mouth. Now, during this course, it gives rise to an inferior labial artery, which supplies the muscles as well as the skin and the mucosa of the lower lip. It gives rise to the superior labial artery, from where near the angle of the mouth. Now, both these arteries are anastomosed with its opposite fellow. So we have the inferior labial artery and the superior labial artery. Thereafter, it courses further towards the side of the nose. Now, here, if you notice, it's going deep to the dilator muscles. So the zygomaticus minor, zygomaticus major, it goes deep to it, but it is overlying the buccinator and the levator muscles. So in between, it's sandwiched between them. Thereafter, near the nose, it gives rise to the lateral nasal artery, which supplies the dorsum and the ala of the nose, and continues forward as the angular artery on the side of the nose till it reaches to the medial canthus of the eye. So this entire course is that of the facial artery, and its branches in the face are the inferior labial artery, the superior labial artery, the lateral nasal artery, and thereafter it is known as the angular artery. The other blood vessel which is going to be supplying the face is the branch of the superficial temporal artery, which is a terminal branch of the external carotid artery. From that arises the transverse facial artery. This transverse facial artery anastomoses with the branches of the facial artery and supplies the face, and at places it supplies the side of the face. As you can see, the side of the face, the temple, and at places it may even take the territory of the facial artery in case the facial artery hasn't supplied that particular area. Another blood vessel which is supplying the superficial as well as deeper structures of the face is the maxillary artery. The maxillary artery is the other terminal branch of the external carotid artery. So the external carotid artery terminates into two branches. One is the superficial temporal artery, which you also see on the side of the face, in front of the auricle. It supplies the scalp. It supplies the temple, it supplies the scalp, and it also gives rise to a transverse facial artery. The other terminal branch is the maxillary artery, which by means of its infraorbital vessels, the buccal and the mental, will be supplying the face. And the other branches which come are the supratrochlear and the supraorbital, which are branches of the ophthalmic artery. Again, the supratrochlear artery is near the midline. It's supplying the midline areas of the forehead, and the supraorbital supplies the more lateral region as compared to the supratrochlear. It supplies the middle of the eyelid, it supplies the middle of the forehead, the frontal sinuses. All these are under the territory of the supraorbital artery. Now, many of these pulses which are seen, many of these arteries are palpable. So we can feel the pulses. One of the facial artery at the anterior inferior angle of the masseter, near the inferior border of the mandible, as we just discussed. We have to clench the teeth and just palpate in front. We'll be able to feel the pulsations of the facial artery. The other is the superficial temporal artery in front of the trachea, where it crosses over the zygomatic arch behind the temporomandibular joint. It can be palpated. So the anesthetists use these two arteries, the superficial temporal and the facial artery, while during surgeries, to assess the pulse of the patient as well as the cardiovascular system. Now, the blood from the face drains via two veins, either the facial vein or the retromandibular vein. Now, let's see the formation of both these veins. This is very important because it also explains the case scenario which we saw in the beginning of this lecture. Let's draw the side of the face, the forehead, the nose, lips, the chin. Within the chin, let's draw the mandible, the body of the mandible, and from that starts the ramus, the coronoid process, the head of the mandible, and where the body and the inferior border of the mandible continues with the ramus. This area is known as the angle of the mandible. Now, the entire blood from the head and neck area is drained ultimately by the internal jugular vein. The internal jugular vein runs from the base of the skull all the way down to the root of the neck. So let's draw the internal jugular vein. As you can see, it is present behind the mandible. It is present behind the mandible. So we will just draw the internal jugular vein, the ultimate area of drainage for the blood of the head and neck. This would be the internal jugular vein. Sorry. Now, the facial vein is formed at the medial angle of the eye. So let's put in the eye. It is formed at the medial angle of the eye by the union of the supratrochlear and the supraorbital veins. Initially, it is the angular vein, and thereafter it follows a straight course all the way to the inferior border of the mandible, where we saw the facial vein along with the facial artery and the marginal mandibular branch of the facial nerve. So somewhere here at the anterior inferior angle of the masseter was where the facial vein was first seen in the face. So this is the facial vein. It is initially superficial to the facial artery, and then it runs posterior to the facial artery. Ultimately, it becomes again superficial at this point at the anterior inferior angle of the masseter. So these two tributaries are the supratrochlear and the supraorbital. Please label it properly, not like I am, because I don't have space. So you will have to be careful. This is the angular vein. Its other tributaries are similar to that of the branches of the facial artery. So it is joined by the lateral nasal, by the superior labial, as well as the inferior labial veins, which are the tributaries of the facial vein. Now, the deep area of the face, that is the face with the part of the face which is below this part of the bone, the temporal bone, this area inside to the medial side of the mandible. This is the deep area of the face. This is drained by a plexus of veins which is known as the pterygoid venous plexus, right? So let's draw the pterygoid venous plexus. Out here, deep to the mandible, is a plexus of veins which is the pterygoid venous plexus. Now, the facial vein is connected to the pterygoid venous plexus by a deep vein which is lying over the buccinator. So there is another tributary of the facial vein, which is this one, which is the deep vein, which is linking the facial vein, with the pterygoid venous plexus. The pterygoid venous plexus is present medial to the mandible. On one end, it is connected to the deep facial vein. On the other, by means of emissary veins, which run through the foramen ovale and the foramen lacerum, it is connected to the cavernous venous sinus. The cavernous venous sinus drains the veins of the orbit. It drains the veins of the cranial vault of the skull as well as the cerebral hemispheres. All right. The pterygoid venous plexus also drains into the maxillary vein. This maxillary vein joins with the superficial temporal vein, which is running with the artery of the same vein, and in the substance of the parotid gland. So somewhere here would be the parotid gland. In the substance of the parotid gland, it forms another system of veins which is known as the retromandibular vein. The retromandibular vein traverses the parotid, leaves the parotid gland and divides into two branch tributaries, an anterior division and a posterior division. The anterior division joins the facial vein to form the common facial vein, which drains into the internal jugular vein. This is the common facial vein, which is draining into the internal jugular vein. The posterior division, this tributary, the posterior division joins the posterior auricular vein and together they form the external jugular vein. So the anterior division joins the facial vein to form the common facial vein which joins the internal jugular vein. The posterior division joins with the posterior auricular vein which is coming from behind the auricle. So somewhere here from behind the auricle, and together they form the external jugular vein. Right? So usually the blood from the side of the face, from the central area of the face, the forehead, the side of the face, the nose, the area of the lips drains into the facial vein, and via the facial vein, through the common facial vein, it goes into the external jugular vein. So this is the normal direction of the flow of the blood. Right? This is the normal direction of the flow of the blood. The blood from the side of the face, that is which is draining via the superficial temporal veins, joins with the venous drainage of the deep areas of the face, which is coming through the pterygoid venous plexus, which ultimately drains into the maxillary vein, and together they form the retromandibular vein. This retromandibular vein is running through the substance of the parotid gland and divides into an anterior division and a posterior division. The posterior division joins the posterior auricular to form the external jugular vein. So this would be the posterior auricular vein that we've already labeled the retromandibular, and this is the facial vein. Now this is the usual direction of flow of blood. Now, all these veins are valveless. The first important thing is that they are valveless and they are lying over a mobile structure, which is the face, which is the facial muscles. They are lying they are lying over the facial muscles. So every time there is movement of these muscles, it ensures there is the flow of blood taking place in the correct direction. Now, what happened in that 18-year-old girl we saw? She developed a pimple on the side of the nose. So somewhere here, she developed a pimple, which she squeezed, as a result of which the infective material may have entered via the tributaries of the facial vein into the facial vein. Now, usually the blood should have flown and all the various inflammatory responses which would have taken place as a consequence of the squeezing of the pimple. Now, usually the blood should have gone from the facial vein into the external jugular vein. Now, as a result of the inflammation which has taken place and this infective emboli, which could have gone and deposited itself in anywhere along the path of the blood, would have resulted in a change in the pressure gradients. That is, they could have been, say, the infective material coming in, come out here. Now, as a result, the blood is unable to move from the facial vein into the internal jugular vein. So, it needs an alternative pathway to reach the internal jugular vein. So, now the blood would change its direction and it would start moving from the facial vein via the deep vein into the pterygoid venous plexus. Along with the blood, the infective material would also enter into it. The inflammatory substances would also enter into the pterygoid venous plexus. And since it's in a deeper area, they could, and from here, again, because of the mobility of the facial muscles as well as the pressure gradients which have got established in this valvular system, the material can enter into the cavernous venous sinus. So the backflow of the blood would have resulted into the material entering into the cavernous venous sinus and causing a thrombosis of the cavernous venous sinus. Now, as I told you, the cavernous venous sinus drains the orbital veins. Ab jab yahan par there is a block and there is no drainage taking place. So as a result, due to the backflow, this would result in the congestion of the orbit, resulting in periorbital edema. It would cause redness around the orbit, and it would also result in the throbbing headache which is taking place because of the thrombosis which has happened out here, and because it's all an infective system, the whole system is now getting more and more infected, it would result in fever. So that is what the young girl presented to us with. So this is due to the alternate flow of blood which takes place via these deep veins to the pterygoid venous plexus and ultimately can result, so it's a rare condition, the septic emboli can move into the cavernous venous sinus and cause a blockage, a thrombosis out here. The clotting of the venous sinus takes place. As a result, there is no flow of blood from the orbit into the cavernous venous sinus, which is its general route, and resulting in periorbital edema, throbbing headache, as well as congestion, which was seen, the redness which was seen around the eye. So this area of the face, which includes the bridge of the nose, the side of the nose, as well as the area of the upper lip, this area is known as the dangerous area of the face. Why? Because the deep vein is present out here. The deep vein forms a communication between the deep facial vein, which is lying over the buccinator, forms a communication between the facial vein, which is a superficial venous system, as well as the pterygoid venous system, and ultimately the cavernous venous sinuses. These pterygoid venous plexus is connected to the cavernous venous sinuses by emissary veins which are moving through the foramen ovale as well as the foramen lacerum. So this is important to remember. It's a very important question. Write the anatomical basis of the what is the importance of the dangerous area of the face. So now let's see the same things, these structures in the dissected specimen. So out here is the lateral profile of the face, and you can see this is the internal jugular vein which is running. This out here is the formation of the retromandibular vein, which is dividing into an anterior division as well as a posterior division. This is the anterior division, the posterior division. The posterior division would join a posterior auricular vein, which we can't see out here. and form the external division. The anterior division joins with the facial vein to form the common facial vein, which drains into the internal jugular vein. Now let's come on to the lymphatic drainage of the area of the head and neck. Now the lymphatic drainage, for the lymphatic drainage, we can divide, again, we look at the side view, the lateral view, and we divide the face into three areas, wedge-shaped areas, which will be draining into three groups of lymph nodes. The first is the smaller wedge, which is centrally placed. This drains the lymph from the lower lip, the tip of the tongue, into the submental group of lymph nodes. The submental group of lymph nodes are present below the chin in this area. Mentum, ये mandible के दोनों mental symphysis है बनाते हैं. The two ends, the two parts of the mandible, they join together at the mental symphysis of the body. So below that, this area is the submental area within which are present this submental group of lymph nodes. Right? So the lower lip and the tip of the tongue drains into the submental group of lymph nodes. Now, more peripheral to this, the area of the upper lip, the area of the side of the nose, from the orbit, the maxillary air sinus, the frontal air sinus, part of the forehead, all these areas, the tongue, the floor of the mouth, they drain into another group of lymph nodes, which is out here, which is the submandibular group of lymph nodes. They are present over the submandibular gland, which is present out here. Okay? Again in contact with the mandible. The forehead, the temple, orbit, parts of the cheek, as well as the contents of the orbit. All these drain into another set of group of lymph nodes, which is the preauricular group of lymph nodes or the parotid group of lymph nodes. From all these areas, lymph ultimately drains into the deep cervical group of lymph nodes, which are present along the internal jugular vein. We will study the lymphatic drainage in detail in further classes. Now let's get on to the last part of this lecture. We'll start this part again with a case scenario. Frantic mother goes to a physician with the complaints of that every time her 2-month-old daughter gets up from sleep, she sees the accumulation of pus at the medial angle of her eye. And there is a lot of tearing which takes place from this little girl's eye. So what is this condition and how can it be resolved? Let's study about that. We've already seen the structure of the eyelid. So let's just recap it. It is lined by, the eyelids are lined by skin, which is one of the thinnest skin which is present in any part of our body. Underneath that is the muscle, which is the muscle in the subcutaneous tissue out here, which is the orbicularis oculi. Underneath the orbicularis oculi is the orbital septum, and the orbital septum closer to the margins, upper margin as well as the lower eyelid margin, is thickened to form the tarsal plates. Within the tarsal plates are present the meibomian glands. These glands secrete oily secretion into the conjunctival fornix. And underneath the, thereafter the tarsal plates, we have subcutaneous tissue. And then this is the lining of the conjunctiva. This is the palpable part of the, the palpable part of the conjunctiva, the superior conjunctival fornix. And this here is the bulbar part of the conjunctiva, which goes up to the corneoscleral junction. This is the levator palpebrae superioris muscle, which is inserting partly into the orbicularis oculi, partly into the tarsal plate, and partly into the conjunctival fornix. Between the orbicularis oculi, the palpable part, as well as the tarsal glands, there is a potential, or there is the submuscular connective tissue, which is continuous with the corresponding layer 4 of the scalp, which was the subeponeurotic layer. And it is here where we saw the conditions of the manifestations of black eye taking place when blood got accumulated. Now, what you have to understand is this part. Now, the conjunctival fornix. When you close your eyes, the conjunctival fornix is shut. It's a closed space. It's a closed sac. But both the bulbar conjunctiva are in opposition with each other. The palpebral conjunctiva are in opposition with each other, and the conjunctival sac is shut. But when we open our eyes, it is exposed to the atmosphere, and its exposure to the atmosphere is responsible for the dryness which may take place of the conjunctiva. Now, to prevent the dryness of the conjunctival sac which is present in our eyes, we have what is called the lacrimal apparatus. The main function of the lacrimal apparatus is to produce tears or the lacrimal fluid. The lacrimal fluid, which is produced by the lacrimal gland, along with the oily secretions which are produced by the sebaceous glands, which are present not only within the tarsal plates, but also are present at other places near the eyelashes. In totality, all these structures keep the conjunctival fornix moist. The oily secretions of the sebaceous glands of the tarsal, as well as the ones which are there, which are moistening the eyelashes, they are present within the eyelashes also, are responsible for preventing the spillage of the tears which is taking place by making an oily film also which is present on the eye. The problem with these so many glands which are present, for example, the sebaceous glands of the tarsal plates, Meibomian glands, or the ones which are ciliary glands which are present near the eyelashes, is that they may get blocked and result in conditions called like the stye, which you see commonly in eyes, or chalazions. All right, but that is the pathological part of it. Now, what is the actual normal apparatus which is going to bring about the production of the tears is what we are going to see. Now, it consists of a lacrimal gland, which has two parts, an orbital part and a palpebral part, which you can see are separated by this thin layer of muscle which is present between. From the direction in which the fibers seem to be running, you can very well appreciate that this is the levator palpebrae superioris. These glands, ultimately by means of these ducts, which are present near the palpebral part, are entering into the conjunctival fornix. Now, where is this gland present? You remember this picture we saw of the orbits? So out here in the lateral part of the orbit, near the roof, is present the orbital part of the lacrimal gland. And in the medial wall, nearer to the nasal cavity, this was the lacrimal bone. This here was the anterior lacrimal crest, the posterior lacrimal crest, and in between both of them was present the lacrimal sac. Please remember. So now, let's talk about the lacrimal apparatus. Now, before we go, one more thing. Look at this. The structure of the eye, which must have on the superficial structures of the eye, which I'm sure the table teachers have discussed with you already. I'll just recap it. Now, these are the eyelashes. These are the eyelids with the eyelashes. Now, look at the medial. This is the medial angle of the eye. This is the lateral angle. We've been discussing the medial canthus, or the medial angle, with regards to the nerves and the blood vessels, which we've been seeing on the face. Now, internal to the medial angle. At the medial angle, you can see this projection, which is modified skin called as the lacrimal caruncle, which is present out here. And thereafter is this lacus lacrimalis, a fold of skin, which is present out here, the lacus lacrimalis, which is also known as the lacrimal lake, because all the tears which are secreted from the orbital lacrimal gland, they tend to move towards the medial side of the eye and form in this particular area, which is the lacrimal lake, because here the accumulation of tears takes place. Now, if we invert the eyelids, we would be seeing in both the upper eyelid as well as lower eyelid, in their medial parts, these two punctas. Can you see these two punctas, or the openings, the lacrimal punctas, which lead into the lacrimal canaliculi, which ultimately takes you to the lacrimal sac. And thereafter is this nasolacrimal duct, this is the nasal cavity. So nasolacrimal duct, which is opening in the inferior meatus of the nasal cavity. Now, this is an important question. So let's draw the diagram and understand all these parts and the flow of tears which is taking place in our body. The lacrimal apparatus refers to the structures which are involved in the production and drainage of tears. The production of tears takes place by the lacrimal gland, which is present in the lateral part of the superior lateral part of the orbit and consists of two parts, an orbital part and a palpebral part. The orbital part is closer towards the lacrimal is closer towards the orbital bone, whereas the palpebral part is in the eyelids. The orbital part is larger than the palpebral part. So this here will be the palpebral part and this would be the orbital part. Both of them are separated from each other by the levator palpebrae superioris muscle. This is the levator palpebrae superioris muscle. The ducts of the orbital part pierce the levator palpebrae superioris and open in the palpebral part. So, the orbital part, by means of its ducts, drains into the palpebral part. The palpebral part then drains into the conjunctival fornix. This tells us in any case, in any condition, when we want to remove the lacrimal gland, it is sufficient to remove this palpebral part. It is sufficient to remove the palpebral part because the orbital part is draining into the palpebral part by means of about 12 ducts. So, just the removal of palpebral part is sufficient. So now let's draw the conjunctival fornix. This is the medial part and this is the lateral part. I don't have pink, you can draw it with pink. This would be the plica. This would be the plica semilunaris, which is equivalent to the nictating membrane in lower animals. Here would be the two punctas and this would be the lacus. This would be the caruncle and this area is the lacus lacrimalis, the medial part of the eye. So here, this side is medial and this is the lateral side, right? So this is the conjunctival sac. These are the two punctas. This is the puncta, which is the superior puncta, and we have an equivalent inferior puncta. Now I'll continue drawing with black. You can shift over to pink. Now what is this? The orbital part and the palpebral part secrete the tears. The tears move from the lateral part towards the medial part, and now if you see, this drainage is also assisted by the orbicularis oculi muscle. The way the orbicularis oculi muscle contracts, that was the orbital part was contracting from laterally towards the medial. We were talking about how it squeezes the eye. This also ensures the flow of tears taking place from the lateral aspect towards the medial aspect. And if it gets paralyzed, this direction of the flow does not take place and the accumulation now takes place at the lateral part of the eye, and paralysis of the orbicularis oculi results in tearing taking place. That is, there is spillage of tears from the lateral side which takes place, as we saw in cases of Bell's palsy. Okay, now from both the puncta on the medial side arise canaliculi. The superior canaliculi initially moves upwards, thereafter downwards. The inferior canaliculi may move, see, straight away it moves horizontally. Now, they may open separately in the lacrimal sac or they may open together in the lacrimal sac, which is present in the medial part of the orbit, in front of the lacrimal bone, in between the anterior and the posterior lacrimal crest. Again, if you remember, the lacrimal sac was being squeezed by the orbital part of the muscle as well as the lacrimal part of the orbicularis oculi muscle. To ensure the squeezing was ensuring the drainage of the fluid, the tears which entered here from the superior and the inferior canaliculi which entered into the lacrimal sac to ensure their movement downwards. Now from the lacrimal sac, from its inferior end, starts the nasolacrimal duct, which is approximately 18 millimeters long. Now here would be the lacrimal bone which is present. Thereafter would be the part of the maxilla and the inferior nasal concha, which forms its walls in which it is present. So this is the nasal cavity, and this is the bone of the nasal cavity, the inferior nasal concha. This is the middle nasal middle, and this is the superior concha. The space which is present, and this would be the nasal cavity. So this is the nasal cavity which is present. Okay, and this space which is present here beneath the concha is known as a meatus. And ये सबसे नीचे वाली है, so this is the inferior meatus. In the inferior meatus opens the nasolacrimal duct. So this is the nasolacrimal duct, which is present in a bony wall which is formed by the maxilla, the lacrimal bone, and the inferior nasal concha. It is guarded at its opening by a valve which is known as the valve of Hassner, which is present on its medial side. Valve of Hassner, which is present on its medial side. This valve prevents the air from entering from the nasal cavity into the nasolacrimal duct and ultimately into the eye, and prevents the blowing up of the eyes. But it does not obstruct the secretions, the pathway of the tears or secretions into the inferior meatus. Now you also understand why you can feel you can taste your tears when you are crying. Now what happened to the little girl which we saw? Now this nasolacrimal duct starts canalization, that is इसका जो lumen बन रहा होता है, it starts during say somewhere around 5th to 8th week of life, fetal life, and it continues, and usually by birth it is completely patent to allow for the flow of tears. But in some children this lower part takes longer to canalize. This is normal, and it may take anywhere around 1 year. So till that point of time, till this canalization takes place, the tears of the child are unable to move into the nasal cavity. They tend to accumulate into the medial part of the eye and result in the growth of the bacterial flora which is present of the eye, in the bacterial flora of the eye, resulting in the sticky eyes, the pus, and the tearing which was seen in a little girl. So this is the nasolacrimal duct obstruction or dacrocystitis which takes place. This is congenital, it is normal, and usually it resolves on its own by 1 year. So the lacrimal apparatus, now let's get back to our lacrimal apparatus, consists of a lacrimal gland. The function of the lacrimal gland is production of tears. This is the aqueous part or the watery part of the tear secretion, which is basically consisting of watery secretion which is equivalent to that of the plasma, plus some antibactericidal secretions which is lysozymes and lactoferrins and IgA antibodies. They are secreted by means of these lacrimal ducts. They are secreted by means of these ducts into the conjunctival sac. Then we have the two puncta which lead into the canaliculi. The superior and the inferior canaliculi lead into the sac, the lacrimal sac, which is present medially. And this here is the nasal cavity. The nasolacrimal duct opens in the inferior meatus of the nasal cavity. So the production is by the lacrimal gland, whereas the drainage part includes these ducts, then the conjunctival sac, the puncta, canaliculi, the lacrimal sac, and the nasolacrimal duct. as we've already discussed, the lacrimal, this is the lacrimal gland. Sorry, as we've already discussed that removal of the palpable part is equivalent to the removal of the entire gland because of the removal of the entire gland because the ducts of the orbital part move via the palpable part into the conjunctival sac. They drain into the palpable part and thereafter the palpable part drains into the conjunctival sac. But even if we remove this lacrimal gland, it does not result in complete drying of the eye because there are certain accessory glands also which are present. Now, as we proceed in head and neck, you will see that there are a number of glands which are present in the head and neck. For example, we have the salivary glands, the parotid, the submandibular, and the lingual glands which are going to be producing secretions. Similarly, we've just studied about a lacrimal gland, which is producing secretions, which are the tears, which are essential to maintain the epithelial integrity, or in simpler words, to prevent the drying of the eyes. Now, these are not under our voluntary control. So they have autonomic control. By autonomic control, we mean that they have the parasympathetic innervation coming to them as well as the sympathetic innervation coming. Now, the parasympathetic innervation means that it is secretomotor to these glands. That is, it is going to promote these glands to bring about their secretion. Whereas the sympathetic neurons, you will see, are mainly involved in controlling the blood vessels. They will be involved in controlling the lumen of the blood vessel, which in turn may indirectly modulate the secretions. But the main focus is going to be the parasympathetic component of the glands. Now, when we talk about the parasympathetic system, we did that very early in general anatomy, that in the entire body, the parasympathetic outflow comes from the craniosacral in nature. That it is being carried by the cranial nerves or by certain sacral nerves which are present. Now, in head and neck, we are bothered about these cranial nerves which are going to be carrying the impulses for secretion. And presently, we are talking about in relation to the lacrimal gland, we'll be talking about the seventh nerve. But before we go on to that, what is a parasympathetic? How does the parasympathetic outflow come? So it arises from some nucleus which is present in the brainstem. From here, the fibers will travel in a cranial nerve and reach a ganglia. Now, this ganglia is going to be situated close to the gland, right? So these are the preganglionic fibers which are going to come from the brainstem via the cranial nerves to this particular ganglia. These fibers are going to synapse, and from there will arise the postganglionic fibers. These postganglionic fibers are going to innervate the gland and bring about the gland to secrete its secretions. In contrast, the sympathetic neurons, we saw that the sympathetic neurons exited from the spinal cord. They traveled in the rami of the spinal cord, entered into the sympathetic ganglia, where they might synapse at the same level or at higher levels, and from there the postganglionic fibers arise again, which go on to the fibers arise which travel along the blood vessels to reach their gland. So this is the general plan of innervation of the glands which we are going to be seeing in head and neck, and this is how the various glands are going to be innervated. Now let's focus on to the lacrimal gland. Now the impulse for bringing about the secretion of the lacrimal gland again is going to be carried by the parasympathetic nerves are going to bring about this impulse. Now ganglia which is involved is this pterygopalatine ganglia. The pterygopalatine ganglia is present in the region of the head and neck, which is present out here, posterior to the maxilla, anterior to the sphenoid bone, parts of the pterygoid plates of the sphenoid bone is this small little place which is the pterygopalatine ganglia. And this ganglia is hanging from the maxillary nerve by means of these two rami, just like we saw in the sympathetic ganglia. These are the two arms through which this ganglia is going to be hanging from here, which is the nerve, which is the maxillary nerve, which is the second division of the trigeminal nerve, right? Which is the second division of the trigeminal. But I told you the facial nerve is involved. How? Let's see. So we have a lacrimatory nucleus which is present in the pons. So from the lacrimatory nucleus of the pons originate the preganglionic fibers for this lacrimal gland, which travel in the nervous intermedius or the sensory root of the seventh cranial nerve. So this cranial nerve has a sensory component to it and a motor component with it. The motor component we saw was the one which was supplying all the muscles of the face. Now, it is also carrying certain fibers which are traveling in this nervous intermedius part of the seventh cranial nerve, which is the sensory root of the seventh cranial nerve. From there, it enters into the main trunk, reach a bend which is present in the seventh cranial nerve, which is known as the geniculate ganglia. See, as I told you earlier, a lot of terminology comes in which we do not know anything about in head and neck at this point in time. Over a period of time, it will become clearer. So please persist. Don't give up just कि ये तो मुझे समझ नहीं आ रहा. समझ आएगा मगर धीरे-धीरे, because a lot of things come in from various areas. So back to the parasympathetic. So through this, in this geniculate ganglia, from this geniculate ganglia arises a nerve, a branch of the seventh cranial nerve, which is known as this greater petrosal nerve. अभी हम सिर्फ preganglionic fibers को trace कर रहे हैं, right? So we have this geniculate ganglia giving rise to the greater petrosal nerve. Now these nerve fibers, this greater petrosal nerve, joins with another nerve which is known as the deep petrosal nerve, and together they form the nerve of the pterygoid canal. In this, the fibers, these preganglionic fibers, are still going in this greater petrosal nerve, then the nerve to the pterygoid ganglion, and then reach the pterygopalatine ganglia, where they synapse and the postganglionic fibers exit, move via the maxillary nerve, in its branch the zygomatic nerve, and from the zygomatic nerve they enter into a sub-branch of the zygomatic nerve, which is the lacrimal nerve, and via the lacrimal nerve reach the lacrimal gland, where they bring about the tubulo-alveolar part, the serous part of this gland, to secrete its secretion. So all this which we traced out here, from the lacrimatory nucleus of pons to all the way up to the pterygopalatine ganglion, these are the preganglionic fibers. So the preganglionic fibers started in the pons, they traveled in the seventh cranial nerve through first its sensory root, then through its main trunk, then they go to its ganglia. From there they hop onto its branch, which is the greater petrosal nerve, and then move into another nerve, the nerve to pterygoid canal, and then they enter into the pterygopalatine ganglia, where they have synapsed. The postganglionic fibers from here enter into the maxillary nerve, into its branch, travel via its branch, the zygomatic nerve, and ultimately reach via the lacrimal nerve to the lacrimal gland. So ganglia के बाद ये जो orange color fibers आपको दिख रहे हैं, these are the postganglionic fibers, and this green are the preganglionic fibers which we traced from the brainstem all the way up to the pterygopalatine ganglia. Right? So this is how the parasympathetic innervation is coming. The sympathetic innervation should travels from the superior cervical ganglia, which is the part of the sympathetic chain, right? The sympathetic chain which is running all along, we saw in the thorax also, the sympathetic chain, उसके जो neck के ganglias है, उनमें से एक है superior cervical ganglia. उधर से postganglionic fibers arise, and these postganglionic fibers travel along the internal carotid artery plexus. They carry along, they form a plexus along the internal carotid artery, from which arises a branch, the deep petrosal nerve. Now, the greater petrosal nerve and the deep petrosal nerve join with each other to form the nerve of the pterygoid canal, which we will see in the sky. And the postganglionic fibers travel through the pterygopalatine ganglion without synapsing, because इन्होंने कहा synapse किया इधर superior cervical ganglia में, तो अब हम ये postganglionic fibers trace कर रहे हैं. They move in without synapsing. They also travel via the maxillary nerve, through the zygomatic nerve, and ultimately reach the lacrimal gland, where they innervate the blood vessels and regulate the blood flow which is reaching this particular gland, and which the blood flow which is coming via branches of the ophthalmic artery. So this is the sympathetic component which is coming. The sympathetic component which is coming into the gland. The sensory, अब जो lacrimal gland को अगर कुछ other sensations की, those the sensory sensations are being carried by the lacrimal nerve. So this is the innervation. When we talk about the innervation of a viscera or a gland, we need to talk about its motor innervation as well as the sensory, like any other here. But since we are talking about the gland, the motor is the secretomotor. एक हमें उसके जो एक्चुअल सिक्रीशन करने वाले पार्ट्स है उनकी इनर्वेशन के बारे में बात करनी है, which is coming from the parasympathetic innervation. And then we have to also talk about what is happening to the blood vessels. How are the blood vessels getting constricted or dilated? That fibers, that is under the control of the sympathetic nervous system. And then we also talk about the sensory innervation. So any gland which we are going to talk about, we should know about the secretomotor fibers, the sympathetic fibers which are coming to it, and the sensory fibers. Okay, so that is about the innervation of the lacrimal gland. With this, we come to the end of the part of head and neck, that is basically the superficial dissection of face and the superficial structures which we are going to see in the face, along with what has been covered in your demonstrations and the lecture part. We've completed almost everything, and now we will move on to the other area which is left within the superficial dissection, which is the parotid in some time. Thank you.